Hi, I'm Mike Leahy. I'm an orthopedic spine surgeon. I've been in practice for 15 years here at Texas Orthopaedics and Sports Medicine. So I grew up in Memorial, locally here in Houston. Went to Southern Methodist University in Dallas for undergraduate training. Then I went to University of Texas Medical Branch at Galveston for my medical school training. I then went to Texas A&M Health Sciences Center, Scott and White Hospital in Temple for my orthopedic surgery training. I then did a fellowship in spine surgery at the Texas Back Institute in Plano, Texas. I was then on staff at Scott and White doing level 1 trauma for about 3 years. And then I came to Texas Orthopaedics and Sports Medicine in 2009. I decided to become a doctor when I was in college. I went to college to play football and had a neck injury. And at that point, with all the battery of testing and MRIs and physical therapy and all those things, I kind of gravitated towards it. I had actually gone to college thinking I was going to be an attorney like my father, and quickly realized that that wasn't really my thing. So with the athletics and the injury, the orthopedics kind of just seemed like a really good fit. So my philosophy for my practice is, especially with spine surgery, you have to exhaust all conservative care first. There are many things that we can do to treat neck and back injuries or neck and back ailments that are not surgery, and they're largely successful. So in my practice, unless there's something imminently or urgently dangerous or potentially going to result in any sort of neurologic deficit, we always try something like physical therapy or injections, pain management, things of that nature. I've also learned with this business, especially with spine, that spine problems can be very emotionally and psychologically taxing just because of the severe pain that people are in. So you really have to be compassionate and treat people like your family. And that's really, really a big, important part of my practice. I treat a broad spectrum of patients from a different demographic standpoint. Age range goes from mid-teens to 80s, 90s. I treat a broad spectrum of pathology, injuries, athletic injuries, degenerative problems, which probably comprises the most of what I do, the degenerative disc disease. So a lot of times people with degenerative disc disease, let's say, for example, will have significant neck or back pain depending upon where the disc degeneration is. Also, along with the pain from the disc degeneration itself, nerves can be involved. Nerves can get pinched by the disc bulging back and putting pressure on the nerves, and that can cause severe arm or leg pain, which can be debilitating. So a lot of times, most of the time, people come in with a combination of the two or some variations of that. I've really gravitated towards a minimally invasive approach to pretty much all the treatments that I administer. When I first got out, I would do a lot of traditionally what we call open surgeries, which is with the larger incisions and longer operative times and more blood loss and all the things that can result in longer recovery times and things of that nature. So at this point, every fusion that I do is minimally invasive. I do a lot of disc replacements, which is what we call motion sparing procedures, which is an alternative to fusions when patients are good candidates. I do all of my smaller, what we call discectomies, when we're removing pieces of the disc to take the pressure off of the nerves. I do those minimally invasively as well. And I found that my patients do better. They do better quickly. Most of my cases, even my fusions, are outpatient or overnight stays only. So I've really noticed a dramatic increase in patient satisfaction, recovery rates, and things like that. What I'd like people to know about me as a physician is that when you come and see me, I'm going to treat you and I'm going to make clinical decisions on you, for you, as if you were a family member. I think that's the best way to practice medicine. I've done that all my life, my entire career, and I think that's what's made me successful in this community. I certainly hope all of you out there never have to have any sort of treatment for neck or back problems, but in the unfortunate event that you do, please come see me at Texas Orthopaedics and Sports Medicine.